Hello, everyone, and welcome to today's webinar, Food Security in Early Childhood. Before we get started, I'd like to go over a few items so you know how to participate in today's event. When you join today's webinar, you selected to join either by phone call or computer audio. If for any reason you would like to change your selection, you can do so by accessing your audio pane in your control panel. This webinar is being recorded. All participants are placed on mute for quality assurance. You will have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of the control panel. You may send in your questions at any time. We will collect these and address them during the Q&A sessions throughout and at the end of today's presentation. I would now like to turn it over to Kathy Glazer, VECF President. Kathy?
Thanks, Elke, and good afternoon, everyone. So glad you could join us today, and we are appreciative of a number of speakers who joined us today to bring information about various efforts in the state related to food security and early childhood programs. So over the next hour or so, we're going to be hearing from this all-star cast, and then also look forward to hearing from you in terms of the questions that you may have. And feel free to put those in the question box, because the point of today is to be able to hear about opportunities, especially in this COVID-19 crisis, for families and children to be able to tap into and access meals and snacks and healthy nutrition, and want to understand too what you all are experiencing and any gaps or needs or opportunities at the local level. So we really appreciate Heidi Hertz, who will get started for us, and she's the Assistant Secretary of Agriculture and Forestry. We also will be hearing from Andrea Gregg, who's Deputy Director of Strategic Initiatives at the Virginia Department of Social Services. We hope to hear from Duke Storen, Commissioner at the Department of Social Services, if he's able to stop by and chat with us today. Sandy Kerwood is the Director of the Office of School Nutrition Programs at the Virginia Department of Education. Paula Garrett is Division Director, Division of Community Nutrition at the Virginia Department of Health. Eddie Oliver is Executive Director of the Virginia Federation of Food Banks. Vivian McMahon is Director of Early Learning Strategies for United Way of Roanoke Valley. And the rest of the all-star cast are all of you who are attending today and have a chance to share some information with us. With that, I'm going to turn it over to Heidi and invite you to get started for us.
Good afternoon, everyone. And Kathy, thank you so much to you and to the Virginia Early Childhood Foundation for pulling this webinar together. I hope that throughout the webinar, all of the attendees are hearing words of comfort and recognizing that there are a lot of organizations and state agencies currently working together around food security and making sure that all Virginians have access to safe and healthy food throughout this pandemic. And my role this afternoon will be to share with you a little bit about the structure of what we're taking on as part of the State Feeding Task Force, and recognizing that there are a lot of emergency operations going on across the Commonwealth and across the country as well as the world. And the way that we function here in Virginia is that we have a Virginia Emergency Operations Center, and that hosts the Virginia Emergency Support Team, or the VEST. And within the VEST, we have various emergency support functions that different state agencies and organizations participate in. And one of those teams that are coming together specifically around nutrition and food security is the State Feeding Task Force. And the reason we've got a specific State Feeding Task Force during this time is that we know that on any given day, there are many Virginians who experience food insecurity. And with the measures that we're taking as a Commonwealth to mitigate the spread of COVID-19, a lot of those mitigation strategies are causing additional hardships on families. Whether it is school closures or changes in childcare, our inability to do congregate feeding, and typical ways to purchase and exchange food, those business operations are swiftly changing, and recognizing that in addition to having the folks that we are typically concerned about as far as how they're getting access to food, we now have a new population, a growing population of Virginians who can no longer depend on the distribution mechanisms that were in place. And so part of the role of the State Feeding Task Force is to first recognize what are the current programs that we currently administer, whether it be through state agencies or through community-based organizations. What are those programs? And then what does the extension and expansion of those programs need to be to cover our current need? And what we're also recognizing as part of the State Feeding Task Force is that this is not a short-term strategy. We're looking out into next month, into the next quarter or 3 months, 6 months, a year, even 18 months. What will the impact of COVID-19 be on the infrastructure for feeding across the Commonwealth? And so that's really the goal of the State Feeding Task Force, is to have conversations and discussions around what is it that we are currently doing, and then what are the steps that we need to take to really mitigate the food access needs. Next slide, please. And so you'll see our primary role is to coordinate that implementation and expansion of food nutrition programs to meet this demand. I do have just a quick snapshot below there of some of the state agencies that are participating as part of the State Feeding Task Force. Many of them are familiar to you as agencies that you've worked with in the past. And you can see the variety of programs that each of these agencies implement. And I feel certain I've left at least one of those programs off, but in our conversations as part of the State Feeding Task Force, we're looking at each of these programs and thinking about what are the needs that we have to better implement or expand the scope of those programs. A lot of them require state plan modifications. Some of them require waivers to federal agencies like USDA. Some of them require requesting additional flexibilities, expanding eligibility, those types of things. And so the State Feeding Task Force is taking the lead on understanding what are the programs, what is their capacity, and then what are the future opportunities for those programs and their reach. And so you'll see that there are many agencies represented across multiple sectors, multiple secretariats, and then also our nonprofit and community organization partners are participating as well. And you'll notice that the way that Kathy and the Virginia Early Childhood Foundation has built the agenda, you'll hear from many representatives of those agencies and the specific programs that they implement that specifically will impact the work that you're doing. And recognizing that a lot of times your role is as a communicator, as a comforter, as a link to what the next steps are. Feel comfortable and confident in knowing that these agencies are here. They are here supporting what you're doing and the efforts that you're trying to make, and really going in every direction possible to make sure that we are utilizing every flexible opportunity to feed Virginians, no matter where they are in the state and no matter what age they are. So we're really thinking across the Commonwealth and across multiple generations. Next slide, please. And you'll see that our structure is that we have frequent meetings. We have gotten pretty good at the Google Hangout so that we can meet and share documents. But one of the things that we're really working on across the State Feeding Task Force is making sure that our communication is up to date and it's coordinated. One opportunity we have is to utilize the governor's 3 times weekly press conferences to make sure that the public, the folks who are accessing many of the programs that we're working on, that they have, that they feel empowered for how they can help their families, help themselves, but then also share information with others. And so we have many agencies working to create outreach materials, but then also coalescing and coordinating those outreach materials into specific landing places. And I'm sure that you'll hear these repeated throughout the talk today, but these are our most critical and most important communication points for the work that we're doing. So you can see that for children 0 to 18, the No Kid Hungry text line that we're most familiar with summer feeding has been reactivated. And so you can see how to text food or comida to 877-877. DOE is also rapidly working to replenish their databases, and they have a link on their website as well as a school meal finder that can be used to find meal and food distribution sites. And then for families and seniors, there's a lot of concern around the older population here in Virginia and nationwide. And so utilizing tools like Common Help, which links to online application, but also provides assistance for many social services across the state. And then calling 211 for many seniors who do not feel comfortable using the internet or accessing online tools. Calling 211 may be the best way for them to connect to services. And then our partners at the food banks have created a landing place for all of the nonprofit and charitable distribution that they're doing through their food bank network at vafoodbanks.org. And so one of the primary roles of the State Feeding Task Force is to support the work that state agencies and groups are doing to make sure that we are supporting each other and thinking about how we can best serve the populations in the Commonwealth of Virginia, and then using the different communication platforms that we have to get the word out to providers, families, and individuals about how they can access food. As I mentioned, this is a strategy and a task force that will be looking not just in the immediate term, but also thinking about what impacts will this have going forward 1, 3, 6, 12, and then 18 months as far as the economic impact of COVID-19 and recognizing the burden that places on families and on organizations. And so I so appreciate the work of the State Feeding Task Force and the voices that are lifting up how their programs are changing. And if you can imagine, as we're beginning to learn more information and having increased mitigation strategies for COVID-19, that is having a trickle-down effect into all of the programs that are being run through state agencies and local organizations, feeding programs being hugely impacted by that. So appreciate everyone's support and your ideas as we move through the presentation today and into the question and answer time. But and thinking that you are a lot of times a great amplifier for the work that is going on for the State Feeding Task Force. So I will end there and be available for any questions at the end.
Thank you so much, Heidi. What a great overarching picture of the depth and the breadth of what the State Feeding Task Force is doing and the implications and as it trickles down. I'm looking to see if there are any questions specific to you, Heidi, but I appreciate that you can stick around in case questions come along later in the webinar. We'll turn now to Andrea Gregg. I want to also check and see. I think that Duke Storen has been able to jump on the line. Duke, are you available?
Hi.
Awesome.
Hello, can you hear me?
Well, yes, we sure can. Duke is Commissioner of the Department of Social Services, and we're happy to hear from you today and appreciate you taking a few minutes of your time to talk with us.
Great. Well, thank you, Kathy, and for all your leadership, and really thanks to everybody who took the time to get on the phone today and the webinar. We really, really appreciate all the service that you are providing, the direct service, the connections to families, the connections to other community organizations in your communities. As we sort of move through the pandemic, food security will become a growing problem in the days, the weeks, and as Heidi talked about, really in the months to come, because it's not just access to programs that were provided in a different setting like childcare or schools or senior centers, but the economic impact of the pandemic will really hit our communities hard. We're already seeing the unemployment insurance and the SNAP and Medicaid and TANF applications. They are up hundreds of percent just in the last 10 days. So, we really appreciate all that you're doing. And, my one sort of encouragement for folks on the phone today is to help us get the word out about where we can address the food security needs. I think you'll see a shift over the next few weeks where we're trying to put more purchasing power in the hands of individual families. So as child care centers close and more parents and children at home with our social distancing and our stay-at-home directive from the governor, we want to put as much purchasing power into those families' hands as possible. That said, there are going to be gaps, and what you'll hear about today are some of those sort of amazing service providers at food banks and schools and Meals on Wheels and home delivered meals that are trying to fill those gaps. And so to the extent that you can get the word out in your communities about the tools that we have to connect people to meals, we'll really appreciate it. So I'm going to turn it over to my colleague, Andrea Gregg, who, among other things, manages all of our food security work at the Department of Social Services. And keep up the great work, everybody. Thank you. Bye.
Thank you, Duke. Can you hear me out there? So I just wanted to say that I want to thank Kathy again and the Virginia Early Child Care Foundation for hosting today's webinar. And thank you, Heidi, for that great review of the framework. I'm really impressed that you were able to get through that without using as many acronyms as we usually use, the EOC and the VEST. As you mentioned, so that was stood up as part of the COVID-19 event. And DSS has responsibility for Emergency Support Function 6, which is Mass Care and Human Services. And as part of that responsibility, we are tasked with kind of facilitating the state feeding task force. So a number of DSS folks sit on that task force in addition to all those private-public partnerships that Heidi had mentioned. The first thing I was going to announce, and I think Duke just covered it a little bit, as expected, the Department of Social Services, we are seeing a large increase in applications. A webinar I was on earlier today said that in the last month, we've seen between a 30 and 50% increase in applications for SNAP, TANF, and Medicaid, depending on the program. But in the last week, it's been just exponential. So I think we can advance the slide. Great, thank you. So Heidi had talked a little bit and she covered the different channels for folks to get information. Some of that's really targeted, but I just wanted to take a minute here to talk about 211 in a little bit more detail. As you all know, it's our central source for information referral in the Commonwealth. The first three bullets here are really about how folks in the community can access that information. The information, again, they can call 211, they can go online and request information via chat or email. The dialing 211 is probably the most heavily used. It's a free phone number. They get connected to a trained professional that will listen to the situation, suggest sources of help. We have one of the largest databases in Virginia. All of our referrals are confidential. But the last two bullets I would draw your attention to are really for folks, and if you would help us, 211, the more information we have in our database, obviously, the more effective it can be. So the last two bullets really are about that. If an organization provides ongoing services to the general public, we are asking that folks go in and update their information on the 211 website itself. That's the easiest way to get information on the services that you provide into the database. We also have new time-limited services that are open to the general public during this health emergency, and those can be emailed directly to 211admin@councilofcommunityservices.org. So again, we have some very specific communication channels that Heidi mentioned. We would encourage folks, please, most folks are applying through Common Help, which is the most, like I said, the most efficient way for folks to apply. It's the easiest way right now. For applications, services, the Department of Social Services, Commonwealth is the way to go. For just general information referrals, we are asking folks to go through 211 for those general requests for information. Next slide, please. Great. So I want to talk a little bit about the SNAP program, the Supplemental Nutrition Assistance Program, some of the waivers and program flexibility that we have in place. Heidi spoke earlier to a number of the waivers, and I know you're probably going to hear about those from some of the other speakers. Some of those are nationwide waivers and require a little less effort on the part of agencies. Some of them require state plan changes. But the SNAP program here at the Department of Social Services has received a number of waivers which have allowed for significant program flexibility. Some were part of the Families First Corona Response Act. Others have just been things that we've been allowed to do over the last several weeks. So a couple of the big ones that we've been able to implement are 6-month extensions to eligibility certification period. So if a household who is currently participating in the SNAP program was up for certification, recertification, during the months of March, April, or May, they have automatically received a 6-month extension. So that's a great help to our households in the middle of this event and this crisis. They do not have to worry about recertifying their SNAP eligibility. The other thing we have is a statewide exemption from our work requirement. That's effective today, April 1st. Again, another huge lift off of those households who are struggling, as we know, with so many other things. This will now allow them additional flexibility there. We very recently received a waiver to waive the interview requirement for applications and reapplications. Again, as we move through this new way of living with social distancing, this will be very helpful as well. Next slide, please. So I mentioned the Families First Corona Response Act that passed. That allowed for a number of waivers and provisions through a multitude of nutrition programs. So one of the things that we were able to do through that act was to issue supplemental emergency benefits to SNAP households. So monthly allotments were increased for households who were not currently receiving the maximum benefit for their household size. So that has gone out for the month of March. The benefits were available on the EBT cards, the electronic benefit transfer cards, on March 25th. And that emergency allotment was at $38 million, and about 225,000 households received that emergency allotment. Again, that was March 25th. The monthly SNAP benefit issuance will follow our regular staggered issuance, which will be the 1st, the 4th, and the 7th. So, and then a second emergency allotment is scheduled for April 16th. So again, we've got this this immediate need in our households that we want to meet. We started receiving calls from folks the middle of March that they were running out of their SNAP benefits and what could we do? Were there going to be emergency allotments, et cetera, et cetera. So getting that emergency supplemental allotment out as quickly as we could was a priority for the department. And again, those were issued March 25th. We've also heard from our folks in our grocery stores, our retail partners, in that the restocking of shelves has become an issue, as we've all seen if you've gone to a grocery store. So what we're doing is, with this schedule that you see, we've gotten some additional assistance out to our households very early, as quickly as we could on March 25th. Then regular SNAP benefits will be available on the regular schedule that those households would have received. Then soon thereafter, we'll have another emergency allotment mid-month in April. So we hope that will help some, certainly help the households that are participating in SNAP. And this should also give retailers an opportunity to restock those shelves so that the folks that we are trying to serve can get have access to what they need in the grocery store. Next slide, please. Another thing that came through with the Families First Act was the ability to operate what you may hear is referred to as PSNAP or PEBT. That stands for Pandemic SNAP or Pandemic EBT. This does require USDA approval, like many waivers. It does require that we submit a plan to USDA for their approval. And this is really exciting to see in early drafts of the Response Act, this was included. And what it does is it allows states to provide SNAP benefits to families with eligible children, with children who are eligible for free and reduced meals during the school year. Once that school has been closed for 5 consecutive days. So this assistance is available not just for households currently participating in SNAP, but those that are not current participants. So we have, and Sandy will correct me if I'm wrong, but I believe we have just under 600,000 children in the Commonwealth who are eligible for free and reduced meals. Approximately half of those children are part of an existing SNAP household. So that's tremendous. We know how to reach those families and those kids. The remaining number of those children are eligible for free and reduced. They're not part of a current SNAP household. So we're working through and identifying ways in which we can get that benefit to those families as quickly as possible. So we will be working with the Department of Education, our EBT vendor and contractor, to try to see the most efficient, effective, and fastest way to get these SNAP benefits to those households. We will be submitting a plan to USDA, which we anticipate would be approved, and we will move through to operationalizing this benefit as soon as possible. As Duke had mentioned earlier, Commissioner Storin, we recognize that there are going to be a number of challenges in ensuring that our families in Virginia are able to access the nutrition that they need. And one of the fastest ways to do that is to increase their purchasing power and provide benefits to them, whether it's through SNAP or WIC or whatever the program is. That is our primary concern right now, and that's what we're focusing on. So that was really exciting. Again, the pandemic SNAP, pandemic EBT, we think will be a huge relief for families, and we are actively working on that and pursuing that in the coming days. Next slide. So again, I'm like Heidi, I'm available. I will stay on through the webinar. If you have any questions, that's my email address. Feel free to contact me separately or as part of the chat feature. And again, thank you to Kathy and the foundation for pulling this wonderful webinar together today.
Thank you so much, Andrea. We have a question for you right away, if you don't mind.
Sure.
This is perhaps a suggestion. Many Head Start programs in the state have family service workers that work closely with their families. The PSNAP or PEBT program would be so helpful. And if you could partner with Head Start programs, that would be another good way to get the word out to families to apply.
Great, thank you so much. Who did the comment come from again, did you say? I appreciate that, really appreciate that.
This is from Gina Lashley.
Thank you so much. Thank you, Gina.
And then another question for you, Andrea, before we shift over to hear from Sandy Kerwood. How will families currently not receiving SNAP get their services?
I didn't hear that last part. Receive the services. We are working through that process now. We would like to do as much as possible to streamline and use, data when we can. We have information. The Department of Education has some information on these households. So we're going to try as much as possible to make this as easy as we can on families. But we are still trying to work through the operationalizing of PSNAP for the non-SNAP households.
Gotcha. Thank you. And Gina has also let us know that she's with Chesterfield County Public Schools, the one who had the Head Start suggestion. Thank you.
Great. Thank you so much.
And Andrea, thank you so much for the great information. What wonderful, robust resources that are going to be available. I also really appreciate hearing about sort of cross-agency collaboration. And with that in mind, we're going to turn now to Sandy Kerwood with the Virginia Department of Education. Sandy?
Hi, good afternoon. I can't believe it's afternoon already. And yeah, to echo the sentiments, thank you to everyone for the great work that is going on out there. It really is a tremendous amount of effort across the Commonwealth to support our children and our families in this extremely unusual and challenging time that we're all facing. And to your point, Kathy, I think the coordination has really been amazing. Working with Department of Social Services, Andrea's and her team and the T-SNAP and the SNAP, that information has actually been very helpful to the Department of Education, and the Department of Education does have a lot of that data that we are sharing back with social service so that they can get those programs up and to the targeted audience that we want. Additionally, working with Paula's team over at VDH as well as VDAX with the food distribution program and the other programs that they administer, there has been a strong collaboration and particularly focused around the food security and the feeding task force that Heidi talked about. So the Department of Education administers the National School Lunch and the School Breakfast, the at-risk portion of the child and adult care food programs, and the after-school snack programs. So as you probably are aware, as the National School Lunch programs became unavailable due to the schools being closed, we were granted the ability to implement the summer food service program. So that was allowed us to transition to unanticipated closures, which most programs were experiencing, and also the ability to offer a non-congregate waiver to both schools and non-school sponsors of the summer food service program. So those are the programs that you're seeing that the schools are participating in. Currently, every school division in Virginia and many private schools, as well as non-school sponsors, are participating in the summer food service program to ensure that children have access to good, healthy meals through their more traditional locations. So we have 154 sponsors currently operating the program in about 1,500 different sites. And each one of those sites is doing something a little different and a little more extensive. So for example, some school divisions are operating grab and go programs where they are having folks that can come by the school and pick up meals. Some are using bus routes, either bus routes for their normal school operates, or they're using city or county bus transit. Others are doing home delivery directly to the homes where those families have less transportation. And some are doing multiple meals. In fact, most now have transitioned to multiple meals to be provided at one time. So they can serve up to 7 meals, 7 breakfasts and 7 lunches, or any combination of 2 meals, a meal and a snack, except lunch and dinner. Any other combination is eligible to be provided through the summer food service program. So as we launched those programs, we now have COVID-19 may mean something to you. We now are functioning under 19 different waivers that allow us flexibility in our programs. As I think Andrea and Heidi mentioned, some of those waivers are waivers to the Department of Education to give us some flexibility. Some of those waivers are specific and we can grant out on a case-by-case basis. And others are those that we can give as a blanket to the divisions or the sponsors, but we need to they need to let us know when they're electing to do that. So for example, we now have a non-congregate waiver for the summer food service program and the at-risk portion of child and adult care feeding programs. So we are launching that. That does require approval from us, and we're launching that waiver today, now that we have clarification from USDA on that. In addition, one of the challenges has been parents being able to pick up meals for their children. As a requirement of the program, previously, children had to be present to receive the meals. With this waiver, parents and guardians are able to pick up meals for their children. It is incumbent upon the program sponsor, either the school or the non-school sponsor, to have a means by making sure that they are picking up for eligible children. Clearly, we want to make it as easy on families as possible. Also, we want to make sure that we maintain program accountability and integrity. We know, unfortunately, there are people that take advantage of these situations, and we want to make sure that the children that are eligible and intended to receive these program meals are the ones that are doing that. So the schools are able to offer that as an opportunity. We've also waived meal times, the number of meals that can be served, and meal flexibility around the meal pattern. So as you can imagine, all of the meal programs do have a specific meal pattern at which they must follow in order to be maintaining reimbursable meals. The reimbursable meal portion of it is extremely important because we want to make sure that those folks that are paying staff and buying food and having to cover the cost of the infrastructure have a mechanism by which to be repaid for that. I know everyone is, job one is to make sure kids get fed. However, it's very important that we maintain some infrastructure so that they have the ability, when all is said and done, to be reimbursed for some of those activities. So we're working really diligently to be as flexible as we can, but we also want to make sure that the children get nutritious meals to maintain their wellness and their well-being, as well as following those patterns to the extent we can. So we've offered meal flexibility to the sponsors, but they just need to let us know what those are. Been very appreciative of Department of Ag and Heidi and her group for really helping us work with the ag sector to make sure that those products that we're having trouble getting into distribution, especially Virginia products, are integrated into our programs, because those people that usually sell food now have also lost their income. So because we have still federal dollars flowing through the Department of Education, we really want to make sure that those are supporting our local communities and our local families that have lost so much in terms of their income. So it really is an important infrastructure and cycle that we're trying to maintain. As you can imagine, managing these waivers and trying to keep these programs stood up in the communities is extremely challenging. That is why I have no slides today, so I apologize for that. But please know our team is working very diligently to help provide technical assistance, resource, collaboration, communication, and everything that we can strategically to keep these folks engaged in the process. As you can imagine, providing hundreds of thousands of meals every week is very taxing on the folks that are actually preparing and getting these meals out. So they are also concerned about their own health and their own family's health, and they have really become the front line in many situations. So we are looking for ways to help mitigate that by doing more meal deliveries from less locations and keeping as much social distancing within the food preparation and distribution areas that we can. So I think probably those are our biggest challenges, is how to identify the areas of highest need to continue to support the folks that are in the trenches getting that work done, continuing to maintain the food supply to them so that they can continue to do that, and really supporting their efforts from a policy and operational standpoint that we're trying to provide from the Department of Education, as well as in collaboration with the rest of the agencies. So one of the things that we're working on right now, actually two things, is how can we help relieve some of the staff that have been working so many hours and so many days in the school divisions by partnering with restaurateurs that have many staff that are now unemployed because they were hourly workers, but they have a skill set that would be very valuable to the school nutrition program. So we're looking at ways for them to partner, and we have a small task force working on that. And then we're also working with Department of Ag and the DoD program. DoD is Department of Defense, but it is the program by which produce can come into the food distribution system utilizing federal dollars and then be utilized by the school divisions as part of their food supply. So looking at ways we can get that local agriculture into the schools in a usable fashion that they can get back out into their reimbursable meals is another strategy that we're working on. So thank a farmer, thank a school nutrition program professional, and thank all of those in the field that in support of the other first responders are really also on the front lines, and to all of you child care providers that are working diligently to serve your families. As you probably also heard, the child care, there is emergency child care sites that are being set up, and we are, Department of Education is, I know, coordinating some of that effort, and we are making sure from the school nutrition program side of it that those sites do have meal capacity to make sure that those children have access to good, healthy food while they're in the care of you all, while their parents are diligently serving as first responders. So that's all I have.
Sandy, and thanks to you. I know what a lift what you're doing, and this is just amazing, the robust resources that have been made available. Folks are commenting about, really loving some of these creative solutions that have come forward, such as using restaurant workers if those restaurants have closed down. We do have a question of, can a district or a school division decide not to continue feeding for fear of risking the health of their staff?
There is no requirement for meals to be served, but please know that Dr. Lane and I are reaching out to those school divisions that have indicated that they're having challenges with that and looking for creative ways that we can resource them to continue to provide meals in some format. We are optimistic that one of the benefits of the PEBT will be to provide some resources to supplement what's going on in the school nutrition program, as well as there is a program called EMYT, Emergency Meals to You, I guess it's MTY, and that is a program by rural areas can apply, and we've sent this information out to the school divisions and other sponsors too. Baylor University does have a program where they're working with vendors that can actually mail food kits to families in rural areas. And so we've had one school division that has applied for that, and we'll be curious to see how quickly that type of program could be stood up. I think, my way of thinking about it's such a balancing act of trying to protect the folks that are in the field doing this good work with the needs of the community, and also to really protect the integrity of the programs to ensure that those federal dollars are still coming into Virginia, because that the longer range issue will be, making sure that the health is taken care of, but also our economy. So anything that we can do to help support those school divisions, I think, with volunteers and other strategies to help them continue that good work and continue to make sure kids get fed while continuing to employ folks and keeping those federal reimbursement dollars coming into the state are all really the balancing that we're trying to accomplish.
Thank you, Sandy. Just a couple more questions for you, and a thank you from someone in a rural area who serves children and families in these areas. Thank you for taking rural needs into account. And a question of, how would a laid off restaurant worker connect to get involved?
We're working on trying to figure that out. So the No Kid Hungry team and Real Food for Kids in Northern Virginia and some restaurateur groups here in Central Virginia are trying to come up with some mechanism to do that. If someone wants to reach directly out to me, I'm happy to channel that until we can kind of stand up this some type of strategy of having a point where people can go and say they're looking for work, and someone can go and say we need workers. So if someone wants to send that to me, I can. Our best bet currently is working in Northern Virginia because we have some infrastructure there with the Real Food for Kids group. But if you want to send that to me now, I'm happy to forward that on and see if we can't get those connections a little bit quicker.
Excellent, thank you. I'll make sure and get your email address to this individual. Maybe some great ideas are on the way. And just one other clarification about, you said the non-congregate waiver was effective today, is that right?
So the waiver, we have, there's two non-congregate feeding waivers. They both require approval by the Department of Education on a case-by-case basis. What we are launching today is the actual waiver form for CACFP. The waiver form for summer food has been out there for about 3 weeks, and I think we're pretty saturated with that. All the school divisions have applied for that. but the CACFP at-risk waiver will go out today. So again, it has to be approved by the Department of Education. That's a requirement of USDA, but we are turning those around really quickly. Those go out in tandem with the application for participation in the program. So most programs that are already participating will be transitioning to the non-congregate method. So they already have an approved application. We're pretty nimble at getting those approved and back out to folks, and getting those dates. If they get the application in, they get the waiver in. The date that they get that to us, as long as we can get that approved, we can approve it as of the date that they submitted it, as long as they meet all the requirements. One of the challenges, as you can imagine, with 19 waivers to manage, we have a reporting requirement back to USDA. So we're trying to do as good a job as possible to get that data on the front end, so that we are not tasking people after the fact to give us that data. So we're trying to collect that as we go to make it a little easier for sponsors to maintain that.
Thank you, Sandy. And, you know, one thing I've been noticing, I guess if there is a silver lining at all to this crisis, we've just noticed such an openness for this kind of collegial problem solving, you know, to come up with creative solutions. And one question that we have is, how can the community partners who are on the call today listening stay informed about opportunities and help with innovation? I think we're providing some venue for that here and sharing some ideas and contact information. But Sandy, if you have any other additional ideas or suggestions for folks who may have, you know, some recommendations or opportunities that they'd like to bring forward to you.
Yeah, they're more than people are more than welcome to email me. I apologize that it's not on my slide, but it's sandra.kerwood@doe.virginia.gov. I'm sure that can be sent out after the fact. I don't think we have a mechanism for kind of capturing that. That might be something that as a group we could come up with. I think pretty much the good news is we all work together, all the agencies and groups work together really well, and we all like each other and we respect each other, and we have a great relationship. I think that actually helps a lot. And we can't wait for the party when all this is over and we can actually be in a room together. But in the interim, if someone else has a great idea on how we can have more of a clearinghouse, I'd be more than happy to help with that. I don't know how quite to do that.
Okay, thank you, Sandy. Appreciate that, and thanks for being so open and willing to receive information to your email. I'm going to ask you one last really good question, and then just giving Paula Garrett a little bit of a heads up that we'll be turning to her next. This question is, how does this apply to private daycares that are enrolled in CACFP to help with providing meals if their center is closed?
That's a great question, and I think actually Paula will be able to take that, because I believe those are probably programs that are administered by the Department of Health. So I will defer to Paula on that question, and then if she wants to bounce it back on how we can partner, that would be great.
Awesome, thank you. Well, we'll hear from her first and then make sure we get an answer to that question for Carol. Thank you so much, Sandy, and if you can hang out, there may be additional questions for you along the way. Next, we're going to turn
Sure thing, I'm right here.
Thank you. Paula Garrett with the Virginia Department of Health. Paula?
Thank you all. Good afternoon. I hope you all, each and every one of you, are staying safe and keeping your family safe. I have the distinct pleasure of being the division director for the Division of Community Nutrition, where the other parts of the Child and Adult Care Food Program is housed, as well as the WIC program. And Sandy did steal a little bit of my thunder, but let me tell you what parts of the CACFP we do cover, and kind of let you know what waivers we have, and then go into the WIC program. So we host at VDH the Emergency Shelter Program, the Outside of School Hours Care Program, child care, adult care, and Head Start and family daycare homes. So those are the other portions of the CACFP that we are covering. Currently, we have about 270 sponsors across the state of Virginia, and that's just for child care. That's not for the other types of care that we provide and support. We've applied for and received several waivers, which should alleviate some of the barriers to access. One of them is the non-congregate meals. Another one is the parent pickup for meals. And then we have 2 monitoring requirements waivers, and then 1 for meal patterns. And what we're doing as far as, let me just tell you, the non-congregate meal site guidelines and instructions were sent out to sponsors last week, and the parent pickup instructions, procedures will be uploaded today on the system and placed on our external website and our internal splash page for our CHAMPS system. In addition, we are meeting with our communications team to put up any additional procedures, processes that will assist individuals who participate in the CACFP with Virginia. And so I'm going to segue into the WIC program, and then Kathy, I will talk about that question that was asked of Sandy, and then she and I may end up having to partner together to provide additional resources in the community. So the other program that I am the director for is the WIC program, and currently we are closed to the public, but we are handling all of our appointments and benefit issuances electronically, meaning either over the telephone or we're pushing those out electronically as we speak. We have applied for several waivers for WIC. One is physical presence, which means that the participants do not have to present themselves at the WIC clinic, and that helps with existing participants and any new participants. We're also asking our participants to check benefits through the online portal that we have, and we're also directing any new participants that may be interested in the WIC program to either 1, call their local agency, or 2, apply through that same online portal, and that is at myvawic.org. In addition, we have a waiver for issuance of WIC benefits remotely, so that the participants, again, do not have to present themselves at the WIC clinic for their benefits to be uploaded. We, in addition, have 2 food substitution waivers. One allows a family to purchase any variety of eggs, looking at size and color. So we have added medium, extra large, jumbo eggs in white and in brown. And in addition, we have been granted a waiver for milk to allow any milk as it pertains to fat content. So we're now allowing our participants to get 2% milk and whole milk. In terms of infant formula, we're working with our nationwide formula contract vendor, Abbott Laboratories, to identify any shortages that we may have across the Commonwealth, and also utilizing our relationship with our wholesale formula distribution center in Lancaster, PA. We have been partnering with our vendor, our authorized vendors, to let us know when there are shortages and what they're shortages of, so that we can work with our suppliers to make sure that these WIC foods are available. So with the expansion of our 2020 food list, this has allowed our participants to have access to a variety of foods and then a variety of choices to include all the national brands for cereal, store labels, and private labels as well. We have been working with our communications team to put messages out to ensure folks are able to receive WIC benefits, they're able to purchase their foods. We now will have a new campaign that will start, I believe, on Monday, a series of messages that discuss, you know, reduce any barriers that we may have to service. So what we have several email mailboxes, and we also have our WIC help desk that is funding a lot of our calls through to participants, to our state agency staff, and then to our local agency staff. We are poised and ready to help anyone with either one of the programs, should they need any help. And with that, if you have any questions, I am open to questions.
Thank you so much, Paula. Great information. I love hearing about the increased flexibility of food choices. That's amazing. We do have a few questions that have come your way, including the one that we may want to circle back to some more. But let me just ask you these. Could you repeat the WIC help desk number?
Oh, I didn't give it to you. Hold on, let me pull it up for you.
Thank you. And as you're looking for that too, I'll also let you know that the same individual has asked the question about how are families who are on WIC getting this information about these additional options and choices.
We have, so for that first portion, we are putting those out on our social media platforms. Our participants are still calling in, and so they're getting it almost one on an individual basis. However, Monday we foresee it. We're putting those messages out on all of our social media platforms: our Twitter, our Instagram, our Pinterest, and our Facebook pages.
Mm-hmm. Okay. Excellent. As you're still looking for the WIC help desk number, I may also ask the individual who posted that question about how the information may be getting out. If you have ideas or suggestions, I feel pretty sure that the Department of Health would be happy to hear about that. Can CACFP participants send milk of any fat content based on availability, or do programs need to apply for a waiver? And this individual is from a Head Start or an early Head Start program.
Well, they kind of take a little bit of some of the lead from WIC as to what we do. Let me, I don't want to have to research that, but I may have to get back to you. Is there a FAQ, Kathy, that we're doing?
Paula, this is Sandy.
Yes, gotcha.
They do need a waiver for a milk waiver for meal pattern flexibility I think for the Head Start program. I'm not so sure about WIC, but they would need a waiver to change the fat content.
Okay.
Okay, you ready for the number?
Yes, we're ready. Thank you.
Okay, it's 877 835 5942.
877-835-5942. We'll get that out to everybody. Thank you, Paula, and thank you,
and
Sandy.
that goes into our centralized help desk, and that help desk does answer questions for both CACFP and for WIC.
Okay, and Paula, is it a multilingual number?
Yes.
Terrific, thank you. We have a participant saying we're hearing that open child care centers who remain open are challenged in getting milk and bread at stores due to the fact that stores are limiting quantities you can purchase. Should this be addressed at the local level, or have state level solutions been sought?
And that's for CACFP?
I believe so.
Okay. I believe we're gonna have to address that at a state level. Should not be a local agency. I mean, a local level issue. Since we have on the WIC side the relationship with the grocery stores already, it may be a conversation that we need to transcend over. Since we do have 840 grocery stores that are part of the WIC program, we need to see and tell people, what's available where, so that since we have that information, it's no reason why we can't share it. So once we find out, I'll have that information put up on the splash page for CHAMPS, and then also put on the external web page for CACFP.
Terrific. Thank you so much. Let me see. Okay, we have someone saying that once again through the Head Start connection, they have email and text contact with all families. So, would love to. I'm going to put you two together so y'all can figure out how to make sure that kind of communication channel can really be utilized. It sounds like a great solution. Thank you so much, Kimberly Poole, for suggesting that. Now let me go back and let's see if Carol's question was fully answered about private daycares enrolled in CACFP to help with providing meals if their center is closed.
Can you repeat that question to me again?
Sure. If there are private daycares that are enrolled in CACFP, but they are closing, is there a way for them to help provide meals even if their center has been closed?
I'm sure that there is. And, can I circle back to you with that answer?
Absolutely. Thank you so much,
Okay.
Paula. Appreciate that.
Can I, this is Duke, can I just jump in here? So the summer food service program that the Department of Education is providing their, drop off and pick up meals, that's open to children 0 to 18. It's not just restricted to school age children. So I know the question was perhaps about the flexibility that child care centers may have if they're closed to continue to provide meals, but the ready availability of those meals through the school systems, I think, is the most important takeaway. So if you can communicate with your families that they are eligible to participate in those drop-off and pick-up sites, I think that would be a good current thing to do.
Mm-hmm. Thank you, Duke, for jumping in.
Yeah, thank you, Duke, for that clarification. Yeah.
Have a follow-up.
Sorry, this is Sandy, and thank you. That's a good point, Duke. Also, if there's a local sponsor that wants to partner with a school district, they should reach out to them directly and see how they might join forces. Because where one might have some capacity with staff, another might have capacity with infrastructure. It might be a good partnership, because we've seen some of the CACFP at-risk sponsors reach out to school divisions and vice versa in that way. Mm-hmm. I'm sure Eddie will probably have something to say about the support from the food banks also.
Thank you. And I do have a follow-up question here about that. For families who don't have access to transportation to pick up from the schools, do you all have suggestions for them?
The schools do have the capacity to do home delivered meals with consent of the parent. So if there are families with that need, they should reach out to the school division first and let them know of that need. And then the schools can see if there is capacity to get those meals sent to them. That would be probably the starting point. If there's any challenges with that, if they want to reach directly out to the Department of Education, we can help facilitate those conversations too.
Excellent. That's just
and Kathy, we have been partnering. We are partnering with DOE, that if we find out about these situations, we'll send that information to those child care centers so that they know what resources they have at their local level.
Thank you, Paula. Here's another question that any of you may want to take a try at answering. We have a lot of families who are immigrants and have shared that they are afraid to go out and request help due to their status, especially the new public charge law. What type of support do these families, can they receive?
So for WIC, the public charge does not apply to us. And so the families can still apply for WIC because we do not ask immigration status information, and we have put out a full communications packet before the pandemic about, you are safe with WIC. Maybe we need to put that back out again there for everybody.
Mm-hmm. Thank you, Paula. Anybody else want to add to that? Add any response to that question? Okay, thank you. Couple more questions.
Kathy, to Duke's point, those families do not need to show any identification when their children pick up meals from the school programs. Those meals are eligible to any child 18 and under, so that's another opportunity for them.
Terrific, thank you so much. And along those lines, do the children need to reside in the same jurisdiction of the school district to participate in the feeding program?
No.
Okay, terrific, thank you.
The sites are eligible as their location, not the children that participate in the program.
Okay, thank you. I'm looking to see if there are any other questions at this moment. Let's see, here's a question about, is the waiver for monitoring requirements for sponsor effective? If not, any idea when?
I think they'll be effective very soon. And I think the procedures right now are being crafted so that everybody has the same understanding. And so that information will be posted ASAP.
Excellent, thank you. And I just see one more comment to the question before about limited quantities for purchasing milk and bread. Jane Glasgow says that it would be a great thing to address as soon as possible, perhaps just a letter or agreement with stores to allow them to purchase more. Just a suggestion. One more. Is there a way that the WIC flyer about status and the presenter's information be emailed to all participants of this presentation? I think I can probably answer that one. We will make sure that that happens, and thank you so much for that request. Paula, thank you so much for the amazing information from the Department of Health. And now we're going to turn to Eddie Oliver, who is the director of the Virginia Federation of Food Banks. Eddie?
Thank you, Kathy. Good afternoon, everyone. As the first presenter who's a representative of the nonprofit community, I just want to start by thanking all of the state agencies who have spoken today. Our state government has really stepped up to the plate during this crisis and have really become red tape warriors, taking advantage of every waiver flexibility available to us to get more food out to people who need it. I've been in touch with some of my colleagues in other states, and they're having a lot more challenges. So we're really fortunate in Virginia that we have such committed public servants who are working to get food out to more people. So I just want to express our gratitude to Duke and Sandy and Heidi and the team at VDH, Paula. You guys have all been great, so we appreciate it. Just by way of very quick overview for those who aren't familiar, there's 7 Feeding America food banks that serve Virginia. We all work together through the Federation. We have a network of a little over 1,500 we call partner agencies. So these are the food pantries, soup kitchens, and shelters that people go to for assistance. They all work with the food banks. Think of the food banks as your wholesale large distributor. Folks aren't coming to the food bank itself for assistance, but they're coming to our partners. We're able to get large-scale donations from manufacturers and retailers, make those available to these partner agencies. Collectively, our network, we serve nearly 1 million unique individuals per year. And that was last year. And so that was while the economy was strong and before this crisis hit. We also operate a lot of direct distribution programs. You may be familiar with weekend backpack programs, school markets, summer and after school meals, and mobile pantries, where the food bank itself goes to fill in gaps that may not be served by our network. We also run the government commodity programs for non-schools. So that's the Emergency Food Assistance Program and the Commodity Supplemental Food Program, which serves about 10,500 seniors with a monthly box of food. So we've been pretty fortunate so far. We've only had around 250 of our partner agencies close so far due to public health concerns. We've been working very closely with them to keep food moving. We've provided guidance on how they can do low touch, no touch food distributions. We're pre-packing food boxes with both donated food and government commodities so that folks aren't congregating in waiting areas or standing in line together, but they can just grab their box of food and move on. This also helps facilitate drive-through distributions, which you're going to see more and more of throughout the state. A lot of our food banks already have strong working relationships with the school systems, but to varying degrees, we've been developing new partnerships with them to address the current crisis, which includes piggybacking food boxes and backpacks onto the school buses that are running distribution routes. And, I just want to say that the tremendous people who are working in the school nutrition departments throughout the state, their efforts are really critical in helping to continue serving families with children while we are able to continue focusing on keeping our agency network going and keeping food moving through there. We have seen far fewer donations from grocery stores in the last few weeks, as you can imagine. Our food purchases are going a ways out. So we're struggling a lot with the food supply chain. We have plenty of food for the moment, but we're continuing to try to identify new streams of bringing food into the food banks. So if you start to hear from local agencies or pantries about challenges with that, just know that that's something throughout the state, and we're all working as hard as we can to fill the gaps. On average, this probably won't be a surprise, but our pantries are already seeing about a 50% increase in people asking for assistance. Some places are even serving twice as many people as they were just 2 weeks ago. With so many people being laid off recently, as they start to go through their savings, we know that number is just going to continue to increase. Some folks, may be wondering how our network is impacted by the government's stay-at-home order. Food banks and all of our partner agencies, including our employees and volunteers, are all considered life-saving essential services. So that has helped us maintain a good percentage of our agencies that have been able to remain open and continuing to serve folks. And I'll just say, to the question about immigrant populations, similarly, our pantries don't ask for immigration status, citizenship status. During the current crisis, we're doing disaster distributions. And so very minimal information is requested. And so folks should always feel comfortable showing up to food pantries for food assistance. It's not subject to the same types of provisions that SNAP is, for example, through the public charge. I just want to reiterate the importance of the federal nutrition programs in this. It's important to remember that the food, we distributed 120 million pounds of food last year, which is 10 million pounds a month. And that is only 1/10 of the meals that SNAP or food stamps provide. So it's just important to remember, as huge logistical operations as food banks are, it's going to be really important that we educate people about SNAP and WIC, make sure they know how to access those benefits, continue to advocate for a strong safety net. And those programs are going to help us get through this crisis more than anything. Please do share our website. We have aggregated all of the agency locators for each of the food banks, which is going to be your most current information for which pantries are open and which are not. All of those are located on our website, the COVID-19 landing page at vafoodbanks.org, which Heidi shared earlier. And we have a map there so you can identify which food bank is yours, and then the specific links to those agency locators. So I encourage you to share those links with your networks. I just thank everyone for everything you're continuing to do to serve families who are in need. Happy to take any questions.
Thank you so much, Eddie. A couple of questions coming in. Let's see. One question about, is there a way to get more shelf milk to families? Thinking that would be a good option.
Yeah, so milk is always a challenge for the food banks. It's one of the most requested items, yet one of the least donated. And I'm talking about fresh milk just because it has such a short shelf life. It's hard to get donated the same way other food items are. So we actually started a milk purchasing program called Milk for Good. And food banks are continuing to buy food or milk through Mayola on a monthly basis. So we do have some fresh milk coming in. Shelf-stable milk is obviously much preferred. We do have some government commodities coming in as well, and we have connections with, I think Shamrock is the producer of shelf-stable milk in the Shenandoah area. So that is a priority for us to continue bringing in for sure.
Thank you. This is a question that is not a question about food, but child care providers are asking about accessing paper products for her program, probably also cleaning products. I guess this is just a question of any suggestions from distribution of food sort of networks, any ideas that have come forward or partnerships that might, spill over to other needs.
Yeah, so we're, in conversations with all the large-scale distributors in the state, some of which do dip into paper products, but obviously those are at a premium at the moment and just hard to come by in general, both cleaning and paper products. So that's, unfortunately, I think a challenge for everybody.
Yeah, clearly is. Okay, Eddie, I think that we are going to turn now to Vivian. We really appreciate the information that you've brought, and if you can hang out, we may get some more questions directed to you as well, Eddie.
Great. Thank you.
Again, thank you so much, and ditto, and I really echo your thanks to our state colleagues. Just amazing things that are going on and coming out of the agencies, and for you as well. We appreciate all of your efforts in the nonprofit sector. We're going to turn now to Vivian McMahon from the Roanoke Valley and have asked Vivian to share a little bit of information upon hearing about some of these resources available from the state agencies and at the state and local levels. Just reflect back a little bit for us, Vivian, about what you are experiencing in your communities. Have you had any aha moments in hearing about some of this? Or do you have gaps and questions that are being experienced by families in your community that we could raise up for our state leaders?
So it's really, thank you, Kathy, and it's really great to hear all of the collaboration that's taking place at the state level, because some of the questions that are coming through, really hit home as to the challenges and struggles that we've been facing here locally in ways that we've tried to be innovative and come up with solutions for addressing these problems. this is something that none of us have ever had to face, and especially at this scale before in our lives, and we don't know how long it's going to last. So that adds to the challenge of everything that we're facing. As far as us for United Way, we've been working to kind of mobilize as a region a community response, and everything childcare kind of comes into my department. So we've been keeping in close contact with the childcare providers that are remaining open and even those that are closed. We have a number of facilities that are staying open, but of course they're trying to adhere to the guidelines that are coming down from the state about keeping groups at 10 or below, including staff, and putting into practice social distancing efforts. And we know that attendance is very low, so there's a lot of struggles financially that childcare providers are coming across. But even with attendance being so low, they're still having all of these struggles with getting enough access to food. So, we locally have really dove into using our existing relationships to see what resources might be available. And some of the things that we've learned in the past couple of weeks are, of course, we know that schools are providing meals for all children under 18. So we've worked really closely in our partnerships with our school systems, recognizing that we were asking for their help to support some of our child care programs who are remaining open, because we don't want to duplicate efforts. And these are children that they're already accounting for. So we were trying to make quite a few connections between our school systems and the child care providers that have remained open within each of those jurisdictions. We also know that many of the school systems in the that serve younger children, that have those VPI classrooms or the early childhood special education classrooms, they keep snacks on hand for their classrooms. And with the closure of schools, we had some school systems that were willing to donate those to us. And so we were very quick to mobilize some well-trained, voluntold husbands to start making the rounds in a very specific way to pick up food at schools and then drop off at provider locations en route. It was a couple afternoons that were very busy, but very well spent. And at the same time, because we've been keeping in contact with those providers who have closed, some of them have been willing to donate some of the supplies that they have and they're not using because they're staying closed. So we got a large donation of cleaning supplies that we were also able to kind of distribute out at the same time. So I think it's very valuable if you have those relationships in place to reach out to them, even if they're closed. They might still have some resources available and may be willing to help. All at the same time, we were able to share paper products from these programs too. So again, just taking advantage of what's out there and available and just connecting the dots for resources. In addition to this, we were reaching out to other partners, which included like our Kroger store, and we have some relations with the Mid-Atlantic Kroger agency here, and they were able to provide us with a letter that we gave to our centers that gave them guidelines specifically as to what they need to bring with them so that they could have some limits lifted for them to be able to purchase enough food for the children that were still in their care. So I definitely encourage everybody to reach out, and if it can be done at the state level, then that's even better, and kind of do some of that legwork for everybody else. But it seemed like they were willing and able to support private providers as they're able to. And of course, their stock is limited too, so I know that that's a challenge for them. But we also did this with our local Sam's Club. We had providers that had been going out to purchase food, and they were allowed 1 bag of chicken nuggets, which we know that's not going to feed a center full of children. But through just reaching out and asking the question and seeing what needed to be had, they were able to lift those limits. For schools that have been using bus routes, they have been willing and very generous to add some of our providers onto their bus route so that they can provide these meals to the children again without trying to duplicate efforts and feed the same children. Some of the schools have said that children need to be present for pickup at those cluster stops if they don't have every house they're stopping at, and we've just tried to work with them to see if we can kind of waive that because it doesn't meet the social distancing standards if we're loading up children from a child care center on a bus to go pick up some meals. So we're just trying to be very thoughtful. And when we really communicate these things to our partners, it makes sense, and everybody's very flexible and willing to help. They want to be responsive. You know, despite all of this effort, we know that there's still some changes to come. So we have begun the process to apply for the emergency nutrition resources through No Kid Hungry, because we don't know what things are going to be looking like as things change from this food program that's currently going through the school systems to the summer feeding program. But I think we heard some great information today, and so grateful to hear about that. But not knowing how long that we're going to be navigating through these new challenges, but just grateful for the relationships that we have and the resources that are available. We're going to continue to, you know, reach out and see how we can best partner with those that we already have relationships with, and really keep that duplication of services limited.
Thank you, Vivian. As always, superstars in the Roanoke Valley. So much going on and so many great partnerships. I'm wondering, while we wait for more questions to be typed in the question box, I'm wondering both for the presenters who gave information today from the state level and also Vivian from the local level, are there questions that you have of each other or information that you think would be helpful to have? Are there gaps that you're noticing at your level, Vivian, that you feel certain one of these state agency colleagues could help provide the answer for? Just want to make sure we use a couple of minutes here. We just have a few minutes remaining, but want to make sure we can close any information loops that we can as you've presented.
Yeah, like I said, one of the biggest things is we're really trying hard not to duplicate efforts. I mean, there's limited resources that are available anyways. And so if we could have, you know, that information coming down from the state about, you know, those things that are allowable, it takes a lot of legwork locally to be able to figure those things out. So kind of trying to figure out a way that that can get trickled down into our community level programs a little easier, so that we're not duplicating our own efforts to learn about some of the resources that are available and the new guidance that's coming down. As I mean, we know it's very fluid and things are changing rapidly and all the time, but that would be really helpful.
Terrific.
So Vivian, this is Sandy. In response to your comment about the children needing to be present, that is a blanket waiver now available. We got that one last Friday. And that applies to both programs that operate under Department of Health and Department of Education. The only request that we have is that the sponsors let us know that they intend to elect that option, and that they have a plan in place that they're self-monitoring on how they're going to make sure that the children that the program's intended for are receiving that. So if it's a child care center and they're dropping off at a child care center for all the children and one adult is collecting those meals, then what they would just put in their plan is, we're dropping off at this child care center, a representative of the child care center is collecting meals for all the children that are participating in that site, and that would be sufficient to meet that requirement.
Thank you, Sandy. That's great. And one thing that we have worked out with them too is like a number count through an attendance log, so that they can, you know, validate who is actually there that day.
Yeah, that's not a requirement for the at-risk program or summer food. That might be different for VDH. In fact, we don't want to know the children's names. That information as an open site. Yeah, so for our programs, we do not want that information, because well, let me just say that we don't want that information. If they want to manage that between the sponsor and the child care center, they are welcome to. But as part of the at-risk program, if that's what they're operating, there is no. That's not part of it, what we're currently doing. So VDH might have different direction if it's a different part of CACFP.
Great, thank you.
So this is Paula. There is a little different, and we can get that information out to you so that you can get it out to your partners.
I want to thank everybody so much. We are right at the 1:30 mark, and we've squeezed every minute and lots of great information. It's just amazing to hear about the robust resources that are available and the collaboration and partnership going on. As Duke mentioned, though, at the top, the needs are going to be growing. And so I think it'll be important that we stay connected and in tune, and just appreciate so much the hard work that everybody is putting forward to make sure that that our children and families have access to food. Thank you so much to Heidi and Duke and Andrea, Sandy, Paula, Eddie, and Vivian, and for all of you who asked so many good questions. We will likely do a command repeat performance of this in the near future, because there's just been so much interest and so much great information shared. Thank you to everyone, and hope you have a great day.